You know, and when I worked at a college counseling center, I worked with a student, and he had fantasies of smothering his roommate with a pillow. Now, fortunately, I mean, that was pretty clear, but these fantasies were so ingrained and so deep, and at the time, I'm trying, fortunately I had really good supervision, and she was great, my supervisor, and we pulled this kid in, and we talked to him, and we said, we're letting your roommate know about, he said, oh, you can't do that. Yeah, we can do that. I mean, he goes, oh, I would never do it, it's just a fantasy. Okay. How many of these kids who go out and shoot folks and do different things say they fantasized about it first, right? Mm-hmm. I had a kid that I was treating in that penitentiary, and he'd been locked up, I think, since he was 13. He had murdered several people, and he had a really long sentence. And when I saw him, he was about to get out in a few weeks, and he said, what's funny is that no one commits a crime without thinking about it first. He said, you may think about it a week before, a month before, a year before. And he goes, killing people is the same thing. You think about it first. He goes, everybody does. He goes, I don't believe they don't. Now, I don't have any experience with killing anybody, but the people that I've talked to that have, I haven't found anybody to refute that yet. So I think sometimes when we focus on core content as clinicians, we have to look at what are their fantasies. How are they seeing the world? I want to know what my clients' fantasies are. And I'm not talking sexual fantasies, but I don't mind hearing about sexual fantasies or weird fantasies or weird proclivities you have, because especially in the environment we're in now, because if they're in therapy and God forbid they go out and hurt somebody, is your name in the paper? Are you going to have problems? Yeah. Did you do anything wrong? I doubt it. I doubt it, because we all operate within the best we can within the confines of our confidentiality and our field and stuff like that. These folks are complicated, difficult folks.